Dr. Amanda with Straightsmile Solutions, straightsmilesolutions.com, and I'm just going to revisit a subject that I've done probably many years ago, which is reminding you what you should be doing on every single kid age 2 to 5 in your practice. And yes, this is quasi-ortho, quasi-airway, quasi-pedo, I don't really care. If you have little kids, preschool age kids, toddler age kids that have teeth in, you need to start screening them. I recommend using our My Phase 1 Smile form. We do have it available in our store, in our document store on my website, Straightsmile Solutions. If you ever are one of our clients, be it concierge, VIP, or premium, we are glad to give you any and all the documents you would like. Just let us know. And sometimes we give giveaways on various webinars, so do sign up for our webinars and you probably will win access to some forms. Also subscribe to our newsletter because we often give away forms if you read our newsletter and respond. But yes, you should definitely do your My Phase 1 Smile screening form. You should also, of course, be doing a kid's sleep disorder breathing screening form. That's also same thing, available in our store, often available for giveaway. And start the process of evaluating. Why? Well, first of all, kids' mouths are not developing to the right width, to the right position because of various habits, soft diets, and things like that, whether it be pacifiers, thumbs, bottles, as well as even just having a soft diet or having a congested nose can cause the jaws to not grow properly. You see various sleep disorder, breathing type of airway conditions present as malocclusions. There's about 2 or 3 primary ones that I see. One of them is your typical kind of steep mandibular plane angle, downward forward head posture, maybe a slight anterior open bite kind of positioning. One is your more low angle, constricted maxilla, vaulted palate kind of thing. May or may not have a small mandible. So there's certain things that you're going to just see. And I can see them easily in a 2-year-old start to happen, which is basically telling me, hey, this kid has some type of airway issue, not sure exactly what caused it or is causing it, but we need to address it and fix it, or this kid is going to continue to develop in the wrong direction, wrong shape, wrong growth pattern. Airways are going to be small. Remember, the tongue of the patient. Oh, another option. If they have a tethered tongue tie, and I'm super sensitive about tongue ties now because I didn't even know I had a severe tongue tie until about a year ago when I went through the whole fun process of doing an OMT evaluation for a blog, and I found out how bad my tongue tie was and how some symptoms that I experience, be it I've had my orthodontics, fixed, but other symptoms that I experience might be directly related to this. So I am getting my tongue release. I've done all the OMT screening, the chiro, the cervical chiro. I'm getting mine done next week. So it's going to be really fascinating to see how it changes for an adult, how you feel, what you feel, airway, sleep, things like that, how that changes, as well as just jaw pain and other funky things that I always wondered. I always thought that women in their 40s were just nuts. And now I realize a lot of it is possibly related to tongue tie. So fascinating, right? But why not fix these things when the kiddos are little so that their airway can grow properly? If your tongue is too tethered to the floor of your mouth, cannot move it, ideally, cannot rest it on the roof of your mouth at rest, then the maxilla does not develop properly because it's related to the floor of the nose, right? And that doesn't develop properly. And having a lack of airway means that your jaws don't develop properly and your brain doesn't develop properly. And I know you guys think that's nutso, but it's absolutely not. Other things like bedwetting can occur if you're not getting the right amount of air. And I've told stories about this before. I always thought it was nuts until I started putting the dots together on various patients that I did palatal expanders on. And I would find out later that their bedwetting stopped after I did a palatal expander. And I'd be like, that wasn't even on my form. What does this have to do with orthodontics? And then it happened to a family member of mine. So I directly knew about this bedwetting in this 8 or maybe 9-year-old boy. Happened to be a family member who we won't mention who it is. But in any case, it was life-changing for him after the palatal expander. So I really, really want you guys to consider airway and habits and screening every kid age 2 to 5 in your practice. It's life-changing. You can do things to help them out. Of course, can bring production in your practice, but that really shouldn't be your primary goal. And I really want you all to get educated up on this and be implementing this. And it really is standard of care if you relate back to the ADA's sleep disorder breathing bill that came out in 2017. This is your job. If you do not know how to do this, you need to be referring this patient to someone who does, because it is standard of care in your practice. And I think in the next 10, 20, 30 years, there's going to start being litigation for dentists who are skipping over this, because it is so incredibly critical. And there's nothing that frustrates me more when I see patients who are in their teens or adults who have it. It's so blatantly obvious. And I'm like, what were their dentists thinking? Just not even referring them, not even educating them. There's so little consumer education on this topic, but it's so blatant once you figure it out that consumers are starting to catch on, and they're finding dentists who know about this stuff. So anyways, boom, I want you to do it. Contact me if you need help. Thanks.